Mike Zweifel back here on the Lafayette County News Program. Pleased to be joined here today, heading out to Memorial Hospital, Lafayette County. Pleased to be joined by urologist Dr. Ian Stormont, taking the time and joining us here. Doctor, as always, a pleasure to have you aboard here on the program, and thanks for coming back here this morning.
Yeah, thanks for having me.
Well, we talk a number of times with Sue Packett and Community Outreach Director at Memorial Hospital, Lafayette County, about a number of different events, but you're here to tell us about a men's health awareness event coming up on Thursday, the 28th of February. Tell us a little bit about this. What's going to be all taking place here in this event?
Yeah, that's correct. So Memorial Hospital of Lafayette County will be hosting a men's health awareness event on Thursday, February 28th from 6 to 8 p.m. This will include educational presentations. There'll be some food, some giveaways. We encourage the women in the men's life to come also if they have questions. We want men and women to come together as a couple if they'd like. And Alex Erickson is going to be there, Dr. Dan Stormont, and myself, Dr. Ian Stormont, to discuss some arthritis issues and joint pain. Dr. Dan Stormont will talk about that, and myself will be speaking a little bit about how to fix erectile dysfunction, low testosterone, avoiding issues getting up too much at night to urinate, and how we can improve your quality of life in those situations.
Now, obviously, Alex Erickson going to be there, a local star on the sports side of things, but obviously helping to encourage folks, and especially men with this event, to take care of their health and to get things checked up on an annual basis or semi-annual basis, depending on the issues you're looking at. Talk to us a little bit here, Dr. Stormont, why it is so important for men who can be stubborn at times to make sure they're getting their annual checkups.
Yeah, men are not always good about going to the doctors, especially when they probably need to, and they have issues. They just live with the issues and put up with it. You know, a lot of these things can be fixed in a non-invasive or minimally invasive way, or at least improved. And, you know, there are things that can happen by letting things go too long. Sometimes, you know, there's issues with your voiding issues and urinating issues can be caused from a prostate cancer or something. So it's good to be evaluated for that before it gets too advanced. It's usually pretty easily treatable. That, along with, you know, a lot of other issues can be addressed if they are found early enough.
And you mentioned earlier on the onset about this event coming up on the 28th of February that men encouraged to bring their significant other, and that may encourage more men to come. And it's also important for the women to kind of get informed as well, so they can maybe detect some signs that maybe the man hasn't noticed.
Yep. Yeah, I think lots of times I end up seeing men, because their special woman in their life, someone that cares about them, has brought them in or mandated that they come in. And so I think it's important for them to come and hear what is offered and learn what things can be addressed and how we address it, and have them come with their partner to their appointments if they do come in and be seen. I think is a good thing to have everybody involved with the care.
So, Doctor, so this event coming up, it's a Men's Health Awareness Night on Thursday, the 28th of February from 6 to 8 p.m. You mentioned it's going to be at Memorial Hospital, Lafayette County. What can folks expect when they come to this?
Well, it's going to be a pretty laid-back, not formal event. Alex Erickson's going to speak for a while. There will be food to eat, and then there'll be a couple presentations, medical presentations. Dr. Dan Stormont's going to talk about the mental and cognitive benefits of physical activity, and then the pros and cons of leisure activities and work activities, and then also what the realistic expectations are for activities in the face of arthritis. As people age, many of them have joint pain and arthritis pain, and that will be the focus of his talk. And I will give a talk on urologic issues. Many people are not even aware of all the urologic issues, of all the things that we can address. And then also we'll talk about the secondary issues that spouses may encounter. We'll talk about, fixing erectile dysfunction from, medical treatments all the way up to minimally invasive surgical treatments. And then also we'll talk about stopping all the nighttime trips to the bathroom and voiding issues, and seeing if we can improve the stream and increase the time in between voids and such like that with minimally invasive or non-invasive approach. Dr.
Ian Stormont, urologist with Memorial Hospital, Lafayette County, our guest here today in the Lafayette County News Program. Doctor, you mentioned the frequent trips to the bathroom, and that's something you'll be talking with guys about. Just give us an overview here. Is it something to take? Is it something to be concerned about if it's happening once or twice a week, or is this an issue that folks just generally for men, if it starts to creep in almost every night of the week?
Yeah, so that can be the initial signs of once or twice a week, and then lots of times it continues to progress and worsen into every night, all the time. What that can be telling us is that the bladder is in distress, and it's working too hard to get the urine out, and frequently this is caused from an enlarged prostate that's blocking the flow of urine, or essentially narrowing the tube where the urine flows out of. And it can tell us that the bladder is working too hard. And ultimately, if this goes on for too long, that the bladder can lose function and stop to squeeze like it's supposed to. It is a muscle, and it can tire out. And once that happens, there's really no good way to fix or repair the bladder. And at that point, then we're looking at different ways to drain the urine, and those are not pleasant and include frequently catheters and things like that. And so, yeah, allowing this to progress a long time can ultimately cause your bladder to, shut down and stop working.
All right, that's just a preview of what you guys will be talking about in 2 weeks' time. Finally here, Doctor, if folks want to come to this event on the 28th, do they have to sign up in advance? Can they just show up that night? How should folks go about that?
They can just show up at night whenever it's convenient for them. Like I said, the doors will be open from 6 to 8 p.m., and you'll be able to discuss directly with the surgeons that are here and ask questions and come when it's convenient for you.
All right. Any costs associated with this event?
No, there's not. There will actually be some giveaways